According to the Centers for Disease Control, or CDC, all confirmed and probable cases of severe pulmonary disease associated with e-cigarette use include those with the following criteria. Number 1, using an e-cigarette or vaping device or dabbing during the last 90 days before the onset of symptoms. And they must have, number 2, an abnormal chest imaging, which includes opacities on plain chest radiographs or ground glass opacities on chest CT. And they must have, number 3, no evidence of an alternative plausible diagnosis, such as cardiac, rheumatologic, or a neoplastic process. Now, cases that are considered confirmed include all the criteria that I just mentioned and those with a thorough negative pulmonary infection workup with the following studies. At a minimum, you need to rule out common viruses such as influenza with the appropriate testing, as well as further evaluation with a respiratory viral panel. In addition, patients should undergo workup for bacterial infections, including sputum and blood cultures, for organisms such as Strep pneumoniae, Legionella, and other common bacterial infections. Finally, other infectious workup should be performed as indicated for HIV testing for opportunistic respiratory infections, if appropriate. Now, in contrast, cases that are considered probable include those with the main 3 criteria that I mentioned, and the infectious workup is either not completed, that is, the patient was not tested for the common viral, bacterial, and/or other infectious etiologies, or the patient appears to have some infection, but the clinical treating team believes that the identified infection is not the sole cause of the underlying respiratory disease process.